Although the number of deaths due to heart attacks has decreased due to recent advances in medical science, a significant number of people around the world die from heart attacks every year. According to our research, there are different degrees of heart attacks, and not all of them are going to lead to death. However, patients who have experienced a heart attack once are more likely to have a second heart attack. The risk of this complication is reduced only when people have fully learned the proper preventive measures. There are some common and obvious symptoms of a heart attack that may be minor and ignored. Before you know what are the symptoms of a heart attack, you should ask yourself these questions. Is smoking to blame? About 20 to 22% of coronary artery diseases are caused by smoking. Even secondhand smokers and people exposed to secondhand smoke are at the same risk of heart attack. Is a family history of heart attack effective? Yes. If you have a family history of this condition, you are more at risk. About 25 types of genes discovered are related to heart attacks. A heart attack is associated with other health problems. This complication is directly related to diabetes, blood pressure problems, obesity, and high cholesterol. Is gender important in having a heart attack? Men are at greater risk than women. It goes without saying that some heart attack risk factors can be controlled, while others cannot be manipulated. However, preventive measures are not ineffective in improving the general health of the body and preventing heart attacks. Heart attack symptoms that should not be ignored: heartburn and gastrointestinal problems. Heartburn is a digestive disorder that can be caused by gastroesophageal reflux. This condition usually occurs in those who lie down immediately after eating and can lead to stomach pain and vomiting. Of course, heartburn accompanied by severe chest pain can indicate the risk of a heart attack. Some people feel pain in the upper abdomen. Women and elderly people over 60 years old are likely to experience these symptoms without knowing that these symptoms are related to heart diseases. Of course, most cases of abdominal pain and nausea are not related to a heart attack, and it is alarming if it appears suddenly and for no reason. Pain in the left side of the body. This is one of the classic symptoms of a heart attack. A person may experience pain on the left side of the body and may mistake it for muscle pain and thus ignore the pain. Therefore, if a person feels pain in the left side, especially the left hand, it is a strong possibility of a heart attack. The best way to avoid any serious consequences is to seek immediate medical attention and treatment. Rapid fatigue. If a person feels tired too soon, he may be at risk of a heart attack. Try to analyze your type of fatigue and how it is. For example, check if your fatigue is caused by daily activities such as walking, climbing stairs, running, etc., or if it happened by itself. These analyses help reduce your chances of having a heart attack if you are at risk. In this case, you can consult your doctor. Excessive fatigue means fatigue that prevents a person from getting out of bed. If you are an active person and suddenly feel extremely tired, do not ignore this symptom. Unstoppable cough. This is one of the most common symptoms of a heart attack. In severe cases, coughing up blood is also observed. Common symptoms of a heart attack associated with a cough include pinkish-white mucus that has appeared as a result of blood leaking into the lungs. Abnormal sweating. Sweating is very normal, but only as long as it is caused by exercise and hot weather. Some people generally lose a lot of body fluids through sweating. However, if a person experiences cold sweats for no apparent reason, it is a worrying situation and immediate measures and emergency examinations should be considered to prevent severe consequences. Jaw pain and sore throat. Numbness in the shoulder and hand is a sign of a heart attack, but most people do not experience these types of symptoms. Instead, they have pain in the neck or shoulder or from the jaw up to the ear. Some also complain of pain between the shoulder blades. Since this pain is temporary, it is often forgotten. Dizziness, not getting enough blood to the heart, means not getting enough oxygen to the heart, which causes shortness of breath and dizziness. This dizziness is often accompanied by chest pain and shortness of breath. All these symptoms are alarming enough for the patient to go to the doctor immediately. Swelling of organs. When the heart muscle does not work properly, waste products are not carried by the blood from the tissues, resulting in swelling. Swelling first starts in the soles and ankles. In addition, when not enough blood reaches the tissues, pain occurs. Heart rate. A steady heartbeat is a sign of a healthy heart. But heart palpitations for no reason can be a sign of the risk of a heart attack. In these cases, the feeling that comes to a person is as if he ran fast. Some confuse this state with a nervous attack. If you have a rapid and irregular heartbeat without doing heavy work, be sure to see a doctor. Snoring. Loud snoring is also a serious sign of the risk of a heart attack. People who suffer from heart problems can take the help of an external monitor to control the level of snoring at night.